The COVID-19 pandemic has paved the way for a bigger mental health crisis. Studies show that levels of anxiety and depression still remain far above the pre-pandemic baseline. 1 in 5 adults have experienced some form of anxiety due to the pandemic, and 1/3 of young people have suffered. I spoke with Samaritan's listener volunteer Alex Henderson to find out more.
Over the past year, more concerns have arose dramatically. These are, economic concerns. People fearing job loss, people fearing income loss, the lack of access to mental health related services. Isolation has been a huge one. We've had many people, especially the elderly. It's amazing that what a walk to the high streets can mean to someone. People just need to speak to people. We are sociable creatures, and humans do need each other. I always say the human mind can be really busy at times with different stresses, different worries, different kinds of anxiety, and you can feel like there's so much going on at the same time, and it's really hard to sort of organise and get these thoughts under control. So if you can, speak to someone. I say firstly, pay attention to your feelings. Feelings may fluctuate and change quite a lot during lockdown. In 1 minute you might be feeling pretty content and happy. The next you might be feeling really sad, and there's some really good apps out there. Samaritans has this self-help app which you can use to sort of journal and monitor your feelings day to day. There's another app that I use actually, it's called Calm. I use it for mindfulness, particularly meditation. It helps me to sort of let it go. This has been a global pandemic and a lockdown that many of us have never experienced anything quite like this before. So just be kind to yourself. Just know that you're doing your best. If you do need help during this time, you do need someone to speak to. Samaritans are available 24 hours a day, 116 123.